Hey Guru Nation, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. My name is Dan Sfera, and I will be here with you today, helping you out. Okay, so if you're new, welcome. All right, make sure you subscribe. Hit that subscribe button. Also, YouTube just introduced notifications, so hit that bell underneath this video so you can get notified each time something comes out. I'm also going to be doing a lot of live streaming on YouTube. So probably our first one today, actually. So I'll be live streaming straight on YouTube. Make sure you hit the notification button. And then you can reach out to me at any social network you're comfortable with. And you can ask questions. You can just say what's up. Maybe we can network somehow. Maybe we can work together. I don't know. Whatever the case may be. So today, someone messaged me on LinkedIn. Okay, and they asked me, they're a CRA, a full-time CRA. And they've been a CRA for quite some time, and they're thinking about opening up an SMO. However, they're not sure they can do that being an employee. I would appreciate it very much if you can share your thoughts on how I should proceed and not jeopardize my relationship with my employer. Well, young CRA who wants to open an SMO, you're not alone. Okay? The good news is probably more of your colleagues than you even realize are thinking the same thing. Some of my best clients, so I do a lot of consulting for startup research clinics, established research clinics. We help you get studies, we negotiate your contracts and budgets, we'll create source docs for you, we'll guide you in the right direction as far as getting CLIA waivers and everything you need, all the essentials you need, and everything that goes into having your own clinical research site. So there's a lot of CRAs, I mean lots, that watch this channel, that watch this blog, and there are lots of CRAs that want to open their own research clinics, right? And everyone has the ambition and aspiration to open an SMO, and everyone wants to get into that right away. Well, the truth of the matter is, unless you're backed, financially backed by venture capital or angel investors, or you're just loaded with cash, you're not going to become an SMO overnight, right? Unfortunately, you're going to take the slow road, which is the practical solution, okay? So just having like hundreds of thousands of dollars of investment money and then opening up clinics in every city you can possibly dream of is a recipe for disaster if you don't know what you're doing. Even if you do know what you're doing, okay? Take the practical approach. So everyone, I just had a call with someone last week. They wanted their same exact situation almost. They're a CRA, they want to open an SMO. I told them, well, start with one site, okay? With one site, with one study, with one PI, and then your goal after all that is to enroll one patient, okay? Obviously you want to do more, but that's how you start, okay? And so people often get paralyzed and don't do anything because they think so big. They're like, I want to do an SMO, and then they start thinking of all the complexities that go into that, and they end up doing nothing. So much more manageable. Get one site, one PI, one study, and then enroll one patient. All right, and then you enroll patient 2, patient 3, and so on. So the person on the other end of the call said, you know, that's great, but where's the money there? And I said, well, that's the trick, okay? You don't quit your current job. You can set up your own clinic on the side, have a nice little side business, get a study, find a PI, and then once you start getting to the point where you need to dedicate yourself full-time to your new position, you don't quit your job until that very last moment. So you maximize your risk aversion, okay? You don't quit your job and go start a site tomorrow, because it's going to take at least 3 months for you to get your first study. It's going to take at least 3 months before that even happens for you to probably get your first PI, and then agree on a relationship, and then agree on a facility. So you're talking 6 months right there. Now, why would you quit your job? Because you're not going to be spending much time on your site during the first 3 to 6 months, okay? You will spend plenty of time on your site after you get your first study, and then you start enrolling patients in your study. So you'll know when you need to quit your job, just because you'll no longer have time to do both. Okay, and then at that point, even then you don't need to quit your job. You can hire a study coordinator and continue working your job and manage the studies, hopefully hire an experienced coordinator so you don't have to be as much of a micromanager as you would if you had a brand new coordinator. Okay, but there's always options. Okay, so coming out of the gates, quitting your job and starting an SMO tomorrow, not a way I would recommend it. Now, as far as your employer finding out, so I'm no attorney, but I know every state, every country has different laws when it comes to non-competes. And again, I'm not an attorney. Check with your own attorneys for this. Check in your employment contract. All right, if you're a W-2 or if you're a 1099, it's very different. Right? Check in your contract. Where's the non-compete? What does it say about starting your own companies? And if you're a CRA and you work for a CRO, you're not actually building a competing business if you build a site. Right? You can make that argument if you were building a CRO. You could maybe make that argument if you were building an SMO, but building your own site is not a competing business. So again, it's not going to cost you much if it's something you really want to do. Invest $1,500 in a good lawyer to look over your contract and then help you set up your LLC, your corporation, whatever it may be, so that it protects you and your assets. Okay, and so that's what I would do. And then it is a small industry, so as far as your employer finding out, I mean, some of our clients use pseudonames when they apply for studies for their site, so that should they come across the same CRO, they don't find out. So there's things you can do in that regard. Or you can just completely outsource all the biz dev to a company like mine, which is what some of our clients do as well. There's a lot of options, okay? But the point is, everyone's going for the home run. Everyone wants an SMO. Everyone wants to start a CRO company. Start one site, all right? Be practical about it. If you get one study and you randomize 10 patients in that study and they all complete, on average, that's $100,000 in gross revenue for you, right? Now, if you have 4 of those studies in 1 year, you're grossing $400,000 a year. If you're doing all the coordinating and you keep your expenses very low, watch some of my other videos and get some of those strategies there, you're already going to be in the top 1% earners of everyone in the United States of America, which is the richest country in the world, right? $400,000 a year. You don't need $4 million a year. You don't need $400 million a year. $400,000 a year. Everyone goes for the home runs. Nobody even makes close to $400,000 a year, and it's something that's very practical and doable for just about anyone who has the resources, the knowledge, which you do, all the raw ingredients. So good luck. Let me know how it goes. Stay in touch with me, and remember, just start small, right? Unless you're loaded with venture capital money, and at that point, that would be dumb money, in my opinion, but you can go for broke at that point. It's not your money, right? Dan from theclinicaltrialsguru.com. Good luck and take care. Bye-bye.